Good afternoon. It is Tuesday, December the 15th, 2020. Segos Oegwego, David Lahashu Juts, and welcome to today's COVID-19 Task Force update on this, our 160th show. And today we'll be hearing from Jaime Dickson, Kahnawake Education Center Communications Officer. We'll also be hearing from Lisa Westaway, the Executive Director of the Kahnawake Memorial Hospital Center. And finally, our last guest of the day, last but not least, Lloyd Phillips, Commissioner of Public Safety. Jaime?
Gwegwe, just here to update the community on a couple of messages on behalf of the Kahnawake Education Center. So first of all, we just wanted to let everyone know that in 2021, our schools are going to be maintaining our 4-day schooling schedule. So students will continue to have Fridays off, with the exception of the first week back. Students will be moving. So we will be moving the PED day from from Monday to Friday, or is that opposite? So just to clarify, because that could be confusing, Monday, January 4th will be a PED day, and Friday, January 8th will be a full day of school for all of our schools. We also wanted to let the community know that we will be closed commencing December 21st until January 1st. And that we will be reopening our schools on Monday, January 4th for our staff, and then Tuesday, January 5th for our students. That Monday is a PED day for the students because most of our teachers are going to be in a conference for the day. That's why we moved the PED day. We would also like to explain that our calendar will be updated and coming out soon in the new year. And we also would like to stress to the community the importance of following the 14-day quarantine if they choose to go away during the winter break. Especially those who have students in school on site. We have to stress that importance that it's our personal obligation to follow these rules as we need to protect our students and our staff when we return from the holiday. And on that note, we would like to wish our staff, students, and the community a fantastic holiday, and also to thank the students and the staff for continuing to adapt and maintain with the conditions that are happening in this pandemic. So thank you and have a happy holiday.
Now, Jaime. Up next is Lisa Westaway. Lisa, of course, is the Executive Director of the Kahnawake Memorial Hospital Center and a member of the COVID-19 Task Force. Lisa?
Thank you. I'd like to start with the negative and then move on to some positive at the end of our talk today. So first wanted to give you an update regarding a number of positive cases. So we presently have 5 positive cases in the community. What's more important about that are the number of people that we have total in isolation right now. So what we're seeing is that in general, and again, this is not about blame or about pinpointing fingers, this is just about advising the community so that we are sure that we have all the information and we make appropriate decisions for ourselves regarding safety. So what we're seeing is that we do now have people who are in isolation as a result either of contacts through family gatherings or through businesses. And this is what we're seeing throughout Quebec, really, so it's not any different than elsewhere. However, it's important that we take precautions as we see this happening so that we prevent further spread of the virus within the community. So for this reason, we really wanted to point out the importance of hygiene, washing hands, distance, and masks at all times, whether in business, whether during our household gatherings. So if we look at when we implemented for mental health reasons that two households can meet within the home while still keeping distance within the home, we see it's been about a month since we implemented that recommendation, and we have had an increase in cases. It's hard to tell whether those increase in cases are a direct result of those gatherings. However, we really want to stress the importance that when you do have another household into your home, that you maintain appropriate distances at all times. So that's more than 2 meters, that you're never within 2 meters more than 10 minutes. And those 10 minutes don't have to be consecutive minutes. They could be accumulative, meaning that if you're within 2 meters of someone for 5 minutes and then you separate 2 meters and then because you remember, oh, geez, we were too close together, and then you're close together again a little bit later for again another 5 minutes, that's cumulative, meaning the 5 plus 5 is a total of 10 minutes, and that would put you in the bracket of being a close contact. So we just want to make sure that that's clear, that if you do have someone in your household, that you are keeping the appropriate distance and that you're wearing masks when you're not eating, and that would ensure safety for everybody. One thing that we wanted to point out, we've said this, but it's worth repeating, because we have often heard arguments about the directives that we have in place from community members who say that we are safe. We would never put our families at risk. Therefore, we don't need to be given directives about how to act. And all of that is true. All of those statements are true. But what we want to remind you of is the fact that when we think we're safe, we aren't necessarily. So we can be contagious without actually knowing it. So many of our COVID-19 cases, our recent cases over the last little while, we're unable to pinpoint the origin. So we don't know where they got the virus. That means that when we think we're being completely safe, even when we're practicing great hygiene, distancing, masking almost all the time, we still can get COVID. And we are contagious for 48 hours before we develop symptoms. So usually when we first develop symptoms, many of us are in denial. We think, oh, it's just a cold, oh, I have allergies. So it takes 24 hours before it actually registers that maybe we should get tested. And so if you consider that, we could be 3 days in contact with people that we love while we're contagious before we actually choose to get tested and go into isolation. That's a long time, and there are many people that we could be in contact and endangering during those moments. So it's really important that we keep that in mind and that we always keep our distance from those that we love, even when we think that we're as safe as possible. We also, I just wanted to give just a small mention about businesses. So since we reopened business several months ago, as we have many measures in place, we've had little impact to our businesses regarding COVID-19 positive cases. So we are seeing a slight increase in number of people impacted within businesses. We want to reassure the community that anybody who has been considered a close contact from recent businesses that are impacted by COVID-19 have been contacted. So just because you have gone in and out of a business that has a COVID-19 case doesn't mean that you have to self-isolate. If you do have to self-isolate, you will have been contacted by our local public health team. So all of these changes within the community and the increased level of risk within the community brings us to holiday gatherings and a little discussion about that. So again, we're not at the point where we want to change the recommendations that we're making, but we want to just talk about them once again so that they're clear, and we probably will talk about them every day until Christmas. So again, what we're asking is that you as community members and as families make decisions about what is an acceptable level of risk for you and your family when you decide what you're going to do during the holiday time. So again, there are no inside gatherings allowed. That's a directive that's in place, and we consider an inside gathering a gathering of more than 2 households at a time. So never during the holidays is it okay to have more than one other household in your home, meaning your home, the people who live in your house, and another household, which is the people who live in a second house, and never more than that. So if you have 2 children, unfortunately, you will not be able to see your both children and their families on the same day. So the safest that we can possibly be at this time is to just be with our own household. So if your tolerance for level of risk is low, meaning you can't accept any risk within your home, or if you are someone who's vulnerable, you have uncontrolled chronic illness, you are immunosuppressed, or you live with someone with those conditions, then you should not have anyone in your home over the holidays or at this time at all, considering the level of risk that exists in the community right now. If you are feel a little bit safer, or you're able to tolerate a small amount of risk, then what we're recommending is that only one household be chosen, and those are the people that you see over the holidays, and that it only be that one particular household. Because then you can have a discussion with that household about their level of risk and what's acceptable for them, and you can ensure that you set up your visitation so that there is appropriate distance between you. Of course, if you have a high tolerance to risk level, then we'd suggest that you have one other household in your home on different days, a different household on different days between the 24th and the 28th. Outside of those days, we really suggest only one household once per week, as we have in place right now. I know it's really confusing. We're going to try to put this out for you to be able to read, and so that you can refer back to it a little bit more easily. But again, the task force recommendation, based on what we see right now, is that you stay within your own household over the holidays. We know that that's practically impossible, so we're trying to give you options that are safe, or as safe as possible. But if you have other people in your home, what we're begging of you is that you maintain appropriate distance, so that within each household you are not risking passing the virus on to somebody within another household, and increasing contacts and increasing the amount of people that will have to be in isolation. Just to talk a little bit about what's happening in Quebec, as you know, or as has been announced widely, there is going to be a press conference by Legault, Minister Legault, or Premier Legault at 5 o'clock or 5:30. And what we're expecting is an announcement of a total lockdown, we think, or something similar to that, between the 25th of December and the 11th of January. So we want to just remind you that these are Quebec rules and not necessarily Kahnawake rules, and we are not at the point where we are recommending a lockdown within Kahnawake. However, based on the situation that we're faced with today, we reevaluate this every single day, and should there be any changes, we will be sure to announce them to you through Facebook Live and through other means as well. But I think it's important just to know that we are at a point where we do have to evaluate that every day, and sometimes more than once a day, in order to make the appropriate decisions to keep our community safe. I'm going to switch subjects a little bit and talk about vaccines. So moving on to a little bit of hope for all of us, because this is hopeful when we talk about vaccines. As you know, the Pfizer vaccine was delivered to Canada this week. The Quebec government is looking at rollout plans throughout Quebec, and that includes plans for Kahnawake. We still don't have a lot of information, but the information is coming in daily, and we expect to be able to communicate more information to you hopefully by the end of the week or early next week. Also, Dr. Gauthier is in the process of preparing a video to be able to provide you with appropriate information both about the vaccine, how it works, side effects, what to expect, why you should get vaccinated. So all of this information we will be sharing with you either on Facebook Live on Thursday or early next week on Tuesday. Also, message of hope. I just wanted to say a really big Kahnawà thank you to all those who made our last Sunday drop-off before the holiday for the residents at KMHC a huge success. A special donation of flowers or plants to all the residents' rooms, both at KMHC and at the Elders Lodge, was really wonderful and really brought a lot of smiles to everyone's faces. And all of you family members and friends who dropped off for your loved ones made the event really special, so thank you. And also to talk a little bit about activities planned for inpatient at KMHC over the holidays, and also a thank you also to the staff at KMHC who are working really hard to ensure that residents, so that the holiday time is special. So there's a lot happening. Just to name a few of the activities: bingo, of course, which is everybody's favorite, a holiday hunt, there's holiday movies, there are special meals, the gingerbread house creation, there'll be two concerts as well. Muchi is going to come and play music, and we have an employee who will also do a concert for the residents, a tea party, and again, as I mentioned, special meals and parties happening for New Year's. So I just wanted to share that information. We're also in the process of organizing a bus ride around the community so that residents can see the lights, and we'll have more information about that later because that will happen after Christmas. So that's about it for my update today. I just wanted to remind you of the importance of being safe. We're at a really, really big turning point right now in the pandemic. We are heading towards hope, as I mentioned, regarding a vaccine, but that's going to take many months before it impacts in a positive way our community, and therefore we have one last part of the marathon to get through, and we really need everybody to work together during this marathon to make sure that we stay safe. And so we thank you. I know it's difficult, but we thank you for all of your hard work, especially over the holidays where we want to spend time with loved ones. Please find a way to do so in a safe way, in a loving way where you can maintain meaningful contacts without actually having to be in each other's space. Thank you.
Kahnawà, Lisa. Up next is the Commissioner of Public Safety and member of the COVID-19 Task Force, Lloyd Phillips. Lloyd.
Thank you, Dave. Thank you, Lisa, for the update. I just want to circle back and maybe touch on a few topics that we've been talking about again consistently over the past couple of weeks, and Lisa just touched on a few of them in her presentation. Basically talking about I guess the critical state of the pandemic which we are currently in. It's unfortunate that this acceleration in number of cases in Quebec, the increase of cases within the community are all kind of coming together at the same time as the holiday season. So we're trying our best to navigate the community in a safe way to ensure that there is a level of Christmas celebration that can be done, but done in a safe manner, but while weighing all the information that comes to us on a daily basis, and sometimes even twice a day, because with having our testing center here in Kahnawake, our own Kahnawake public health team doing an excellent job and contact tracing, it gives us the ability to monitor the situation very closely and react on a moment's notice. We are hopeful that we don't have to follow the path that that Quebec is following in terms of moving towards shutting down many of the businesses in the province. We have measures in place that are that supersede the measures that are taken in the province of Quebec. We have our own inspectors who are out there doing their job and following up. So we feel, I guess, we are doing much better than most places outside of Kahnawake. But that's not to say if the situation evolves and based on scientific data and information that we receive, that the actions can't be taken if we deem that to be appropriate. Because the more cases in the community equals more contacts in the community, which equals the potential for having major outbreaks in Kahnawake. So all these things considered is something that we're watching. Again, like Lisa mentioned, it's day to day, hour to hour at times. And it truly is everybody's responsibility to do their part. Whether you be a business owner, whether you just be an average community member, in various leadership roles and such in the community, it's everybody's responsibility to do our own part to ensure that the collective of our community remains as safe as we possibly can. And we'll do our part, certainly as a task force, to help guide, recommend, and at times, yes, we have to put in directives that are enforceable, if required. And it's all based on the safety and security, of our community. Because as Quebec, even today, over 1,700 cases identified, unfortunately more deaths, and that's been the trend for a while. And despite, there's some light at the end of the tunnel, as Lisa mentioned, regarding the vaccine, keep in mind, it's going to be months down the road before the general masses of the population are able to get vaccinated. So we have, as she mentioned, this marathon that we're in, we still have to get to the finish line. We're not there yet. We have to keep doing what we got to do to keep ourselves safe. I know people don't like to hear that, and it's getting tiring to talk about pandemic. Believe me, we get it. We understand, as members of the task force, as the ones who are here every day, we understand it fully. We understand the impacts it has on your life. We understand the impacts it has on your business, and just obviously within your family. But we got to be careful. Even though there's that glimmer of light at the end of the tunnel, and we see that there is a finish line coming into sight. We've been in this 10 months, and looking at January, and if things don't turn around, and if after the holiday seasons, if people have not been being safe and not maintaining distancing, and things continue down the same path, January has the potential of probably being one of the worst months, or being the worst month of the entire pandemic. So again, I mentioned that to you as a means to ensure that you understand the critical state in which we are in. And again, it's everybody's responsibility to take that extra vigilance, extra steps, extra measures, extra serious, over the next while, because we understand the holiday season. People want to be festive. People want to enjoy themselves. But as I mentioned on K103 last week, the same reasons why we want to gather with family, is because we love our family, but that's the same reason why we have to be extra vigilant and sometimes be apart, because we love one another and because we want to ensure that next Christmas, and into the next several months, we have everybody with us and do every piece that we could do to ensure that we're all together at the end of this. There has been some recent information that we want to also put out to the community. As you may recall, about a week and a half ago, there was a directive that was passed by the task force, Directive 51, which basically calls upon anybody who is a business owner or anybody in the community for that matter who is tested outside Kahnawake. And if they get a word that one of their employees or a person is positive, that they must contact the Kahnawake local public health team to inform them that they have a person who has been identified as a positive COVID case. This allows us as a community, to our local public health team, to do the proper contact tracing in a quick manner, identify those potential high-risk contacts and isolate them to avoid any outbreaks. We've taken this responsibility very seriously in our community. Our team is doing an excellent job. There are public health teams outside of Kahnawake. Quebec has their own teams, but they don't have the resources and they don't have the time to dedicate the way we are doing in our community to ensure people are safe. So Directive 51, obligates anybody who has tested outside the territory, who has been positive. You must notify our Kahnawake local public health team. It's imperative and it's extremely important to the decision-making process that has to take place, regarding any future directives, any future course of action that needs to be done, by the task force or by the community. Also, there is a reminder going out to all businesses. It will be posted on the Facebook page in just a little while. Also hand-delivered to all of them. Again, reminding them of the importance of not only Directive 51, but all the measures that have been put in place since the beginning of the pandemic, the directives that have been issued, and the importance of each and every one of them to take that really serious and make sure that you do that extra to make sure you're keeping the community safe, your employees safe, and obviously everybody else as well. So, I don't want to end off by just talking about the negatives, and because we're trying our best to keep a positive light on things moving forward, but I want to emphasize and underscore the real importance of us taking this serious, being strong, remaining vigilant, and making sure we all do our part. We'll see today what exactly Quebec is going to be issuing. We have an idea that they're going to be doing some severe closures in terms of businesses, shortly after the holidays, some additional measures and as well. As was mentioned twice already, we look at those very closely. We're not at that point yet, but as more information comes in, more data comes in, we assess that on a day-to-day basis. We will be in touch as quickly as possible if there's any new developments for the community. We do obviously have our Facebook Live as well as other means at our disposal. And if need be, we will have a Facebook Live, outside of our normal scheduled programming if we need to, from now until throughout the holiday season. So with that, I'll leave it there and then turn it back over to Dave. So thank you and have a good evening. Onigawahi.
Lloyd. And that's it for this program. Thanks again for joining us today, and we'll see you again on the next one. So everybody, please remember, wash your hands, wear your mask, and remember to social distance. Yawagoa, Danu, Onagiwahi.